My patient had a small bowel obstruction. It wasn't a complete obstruction. They did a CT scan and an x-ray to monitor it. They put her on NPO, so the only thing she could have was ice chips. And she had an NG tube on intermittent suction. The primary assessments to make would be listening for bowel sounds, checking the placement of the NG tube, watching intake and output of fluids, and monitoring blood pressure, pulse, orientation, just because her electrolytes may become out of balance because of the dehydration and rehydration. And we'll want to watch those labs too. The risk factors that put her at risk for this, it could be obesity, Crohn's disease, diverticulitis, swallowing a foreign body, which wasn't the case here, hernia, bowel intussusception, where it like telescopes on itself, cancer, dehydration, abdominal surgery. Then the complications that can occur, infection, tissue death, short bowel syndrome, which just means that they can't absorb nutrients the right way, dehydration and death. We're on alert for lack of bowel sounds, nausea, vomiting, pain, irregular pulse, low blood pressure. Just watching those vital signs to make sure that they're stable. And what can I do to prevent complications? Just keep checking vital signs, administer meds, fluids as ordered, and do rounds on the patient, just because the more you're in there, the more you're going to notice a change. So my first system that I wanted to look at was GI, because obviously this is the main system that's impacted. We listened to her bowel sounds on the 10th, and they were present and hyperactive, which is a good thing. The x-ray on that day showed that the obstruction was clearing, so it was likely inflammation that caused it. The NG tube was in the correct placement. It didn't move at all. We did get to remove her NG tube later in the day. She was hoping for food because she was hungry. She'd been NPO since November 7th, and it was November 10th, so I'm sure she wanted something. Her protein was low on the 8th when they took her labs, and her albumin was low as well. And I'm thinking it was probably due to the diarrhea that she was experiencing, because she just couldn't hold on to those nutrients or absorb them because of the vomiting and diarrhea. So she was on Protonix just to block that acid. It's a proton pump inhibitor, so it's going to stop the production of gastric juices. She was provided ice chips for satiety, but it really wasn't helping. I mean, it really wouldn't help me if I was NPO. We gave her lozenges for sore throat because of the NG tube and the acid. Excuse me. IV fluids to maintain hydration without using the GI system, just to give it a rest, and then pain for the pain meds for the pain in her left upper abdomen. She complained of being hungry and wanting to eat. She was disappointed that after we removed the NG tube that she couldn't go on her clear liquid diet, but the doctor hadn't placed that in the order, so we couldn't let her do that, so we continued with ice chips. The lozenges relieved her sore throat. Her labs show that hydration is working, because all of the labs that were out of normal limits were coming back into normal, within normal ranges. And she reported pain relief with her morphine and her OxyContin. The second one is her cardiovascular system. Her pulse on the 10th at 9:24 a.m. was 86. At noon, it was 66. At 3, it was 75. Blood pressure at the same times was 124 over 80, 130 over 83, and 128 over 89. She has palpable pulses bilaterally, and her color is normal for her ethnicity. We assessed vitals throughout the shift. The blood pressure is slightly elevated. It could be due to stress or anxiety. She doesn't currently receive any meds to lower the blood pressure, and anxiety meds are as needed, and we didn't give her any on shift. Patient seemed to respond to the pain meds favorably, but it did not show a difference in her vital signs. And then 3 is her respiratory system. Her CO2 was high, or her CO2 was 16 on the 8th, 20 on the 9th, and 18 on the 10th. And her respirations on these are all from November 10th, were 18, 16, and 16. Her oxygen saturations were 98, 97, and 96. Her chloride on 11/8 was 114. On 11/10, I listened to her lungs, and they were clear, and her breaths were even both sides. Patient was dehydrated on November 7th and November 8th when these labs were, the chloride was high. This is likely to cause the CO2 to drop because of the rapid breathing. Increase in hydration made the respirations decrease. So O2 sats were not impacted, CO2 and chloride going back within normal limits, and respirations were within normal limits on the 10th when I took her respirations. And then on to renal, her blood urea nitrogen on the 8th was 28. On the 9th, it was back down to 11. And then on the 10th, it was 9. She was dehydrated due to a loss in fluids due to diarrhea and vomiting. She received Protonix and Zofran for nausea and vomiting to stop fluid loss. And she was receiving IV fluids, lactated ringers to make sure that we're getting those electrolytes in there. And then once we started the IV fluids, her blood urea and nitrogen went back within normal limits. So we're not seeing any kidney troubles at all.